So, good morning, everybody. Myself, Dr. Thipperudraswamy, and I have written book on personality development system and many other books, dissertation made easy, and book on screwy rulers and all. But today, I'm mainly discussing about the coronavirus. Mainly, that is about the diagnosis and the stages of this coronavirus community acquired pneumonia. So, firstly, let me begin this speech with the saying of our Chanakya ji that at difficult situation, the person who can withstand the difficulties efficiently and can handle the difficulties effectively will only survive, not the person, not the intelligent person. This is the basic rule in the human environment. So, intelligence doesn't matter if it is not applicable at the correct time, needed time. Okay, so now, so we'll go very fast because long videos are difficult to watch. Okay, so diagnosis of coronavirus disease. Remember two things. One is ante-mortem diagnosis and other one is post-mortem diagnosis. Ante-mortem means during the disease and the symptoms and the patient was alive. Post-mortem means when the patient is dead. Remember, Germany has banned, the government of Germany has banned post-mortem diagnosis of coronavirus. According to me, this is not acceptable because there is a chances of spread of coronavirus from the dead bodies if you don't diagnose it as a coronavirus. Okay, there is a definitive procedure for disposing the bodies and all. So it's my request. Okay, the second thing which you have to remember is, so in the ante-mortem diagnosis we have the upper respiratory tract infections and lower respiratory tract infection. Upper respiratory tract infection we have nasopharyngeal swabs, oropharyngeal swabs, nasopharyngeal wash, oropharyngeal wash, nasopharyngeal lavage. Okay, and droppings. Okay, they are very important, and you can collect the sputum also. Okay, sputum. Okay, and that will be in the lower respiratory tract. In the lower respiratory tract infection, you can collect the bronchio alveolar lavage, bronchial washings, bronchio alveolar brushings. Okay, and in the post-mortem, you can collect the lung biopsies, and you can even collect the swabs also. But most important in case of post-mortem diagnosis is your lung biopsy. That is endotracheal, tube aspirate and all. Okay, what they are trying to say. In case of he was in a ventilator and all. Those are the things which you have to remember. Now, what temperature you can store at 2 to 8 degrees Celsius. If you are delaying the sample processing for more than 5 days, you have to store it at minus 70 degrees Celsius. I repeat, the nasopharyngeal, oropharyngeal swabs, washings and lavage, sputum, and bronchoalveolar lavage, washings and brushings. In some patients, they say you can collect the intestinal samples and even urine and even the stool and all in the postmortem. Okay, but 90% I prefer the respiratory samples because it is one of the respiratory disease. The first thing which you have to remember here is you have to store the samples, and you can do it. You can process it. I mean, you can transport it in a viral transport media. Okay, VTM we call it as viral transport media. You can transport the samples. If you want to process after 5 days, you have to put it in a minus 70 degrees Celsius, or else you can process it for 2 to 8 degrees Celsius. Keep it for 2 to 8 degrees Celsius. The second thing is you're doing one is serological test, and the one is molecular test. Serological test we are doing with the blood. Okay, whether it is in the acute stage or in the convalescent stage or in the asymptomatic stage, if the antibodies to the coronavirus are present in his blood, you are going to detect it. We say it as a paid serum. A single negative shed test cannot be considered as negative. Okay, unless you do you see the rise in titer of 4-fold rise in the titer of antibodies after 2 weeks. That's very important in all serological tests. Same thing is applied here, and all viral infections, the immunological response will be boosted like anything. It will be triggered like anything. So the response 4-fold rise in the titer of antibodies definitely will be there in case of coronavirus in the serological test when you use the serum. The second is molecular test, that is called as nucleic acid amplification test. We call it as NAAT test, NAAT, NAAT test, or nucleic acid amplification test. That mainly we are using real-time reverse transcriptase PCR, polymerase chain reaction. Reverse real-time is because the shortest time we need to get the report, real-time. Reverse transcriptase is the main enzyme in the coronavirus that activity we are going to detect. So real-time reverse transcriptase PCR is the main diagnostic procedure test in case of coronavirus. Again, there are two categories. One is when you are testing in a place where there is a known coronavirus case, positive case, and when you are testing in a place where there is no coronavirus known positive coronavirus case. When there is no positive coronavirus case, no positive, you have to search for two targets of the coronavirus, that is we call it as NES RD-RP genes, NES RD-RP genes, reverse transcriptase enzyme, and these genes. Okay, at least two targets. It should be positive in a place where there is no known corona positive case. Okay, if there is a known corona positive case, you can detect only single target is enough. And even the beta corona, again, types of coronavirus, there is alpha, beta, and delta. There are 4 types of coronavirus, of which beta coronavirus is more virulent and most common human pathogen, isolated. Okay, so when in a known coronavirus positive case place, you can search for only one target, either NES or RD, RP gene. Okay, RD, RP gene. Okay, these are 4 genes you can go into target in case of this coronavirus. Okay, targets, they are the genomic targets. And one more thing which you have to remember here is, in known positive, one single target is enough. If there is no positive case in that place, you have to search for 2 targets and confirm it. Okay, and second thing is, I have seen the breath test. So we see the quantification of reverse transcriptase enzymes in case of the HIV, but it is I don't know. I read in some article that the quantification of reverse transcriptase enzyme in the aerosols of the patient and screening of that reverse transcriptase enzymes in the aerosols of the patient is the most easy and efficient diagnostic technique. I think some countries are following. I think it is Germany, they are following this procedure. You directly hold it. There is a mixture of something that is reverse transcriptase assay, we call it as. Reagents will be there in the tube. Okay, you just have to put that in front of the patient. Either he has to throw the air from his nose or from the mouth like this, and you have to close the tube, okay, top of the tube, and you have to wait for the reaction to happen, and you have to radioactively judge the radioactivity in that mixture by the spectrometry. Okay, so that's what it's a rapid test, and this is the most widely what the test we are doing in India is just we are screening for the fever for the all patient, but you can do this test, screening test. It is more efficient, more effective, and it is little bit costly also, because it is reverse transcriptase quantification in the breath aerosols, because it can detect the amount of the coronavirus shed in the patient. Okay, that is also very important. You have to remember this. So directly, it's a reverse transcriptase assay mixture in the tube. You directly hold in front of the patient whom you are screening, either to throw his breath, okay, blow his breath like this, or from the nose, and close it up and wait for the radioactivity in that mixture. That is one of the diagnostic technique. These are the diagnostic procedures is followed. And next I am discussing about the stages of